Time being, what is it, 9:01. I'd like to call this meeting to order of the Public Health Committee of Kane County for Wednesday, May 19th, 2021. I am Committee Chair Jared Sanchez. Clerk, could you please call the roll?
Silva,
Present.
Lewis,
Lewis here.
Shepro,
Shepro here.
Strathman,
Strathman here.
Tepe,
Deppie here.
Pura. Sanchez.
Here.
You have a quorum.
Okay, can I please have a motion and a second to approve the minutes of April 21st, 2021? Mr. Shepro
Moved.
moves. By anyone?
Lewis second.
Who was that?
Lewis second.
Lewis seconds. Thank you. Any questions, comments, additions, or deletions? Hearing and seeing none. Please call the roll.
Lewis. Shepro.
Lewis, yes.
Thank you.
Sorry.
Shepro.
Yeah, yes.
Strathman,
Strathman, yes.
Tepe,
Deppie, yes.
Silva.
Silva, yes.
Sanchez.
Okay, for finance and budget, does anyone have any questions about the budget report for the Health Committee for this month? All right, we'll go to public comments on agenda items. I'll take public comments on non-agenda items at this time as well. There anyone? Okay. Animal control. We have Brett.
Good morning,
online.
everyone. How are you today?
Good. How you doing, Brett?
Very good. So mine's pretty short and quick. I'll get everybody to health right away. Our revenue exceeded expenses, which is what our goal is every month. So we're continuing to stay on par with exactly what we want to do. We did just have our second vaccine clinic of the year, and I just want to give everybody some quick updates. So far this year, we've seen 211 animals. That's 70 dogs, 41 cats. Of those, 39% have been seniors. This is exactly what our low-cost clinic is all about. In this clinic, we've already done 53 microchips. That's 2 clinics, 53 microchips. That exceeds what we've done every year. Our goal is to try to get every animal we can vaccinated, or microchipped, excuse me, and vaccinated, because this helps if they're lost. We can get these animals rehomed, and again, that's what our goal is, to help these animals stay home, get back home if they do get lost, and do everything we can to help protect the community. Also, one number to point out is 3% of those numbers have been out of county. It's been great to see that we're doing such a wonderful thing here in Kane County that actually people from other counties have actually started to come and utilize our services. So it's just been nice to see that word has gotten out about what we're doing and people really want to come. Our next clinic will be on June 12th. It's going to be a Saturday. Then we're off in July and we'll be back for August, September, October. I hope to have those dates later today. So by the next board meeting, I will have everybody with the remainder of the dates for this year. Again, we're very excited. These numbers have been fantastic to start the year, and we hope they keep up and people continue to utilize the great work we're doing here. If anybody has questions, I'm always available. Madam Chair, go ahead.
I don't mean to be naive, but what does a microchip do? I know it identifies, but what information does it have in it or on it?
A microchip is about the size of a grain of rice. It's actually put in the universal location is between the shoulder blades. What it carries is a unique identification number based on the company and based on a very unique number that only that animal would then have. These animals, lost, found, however they come to us, we scan their whole entire bodies. We carry what's called a universal scanner to make sure, because there's multiple companies that actually produce these microchips. So when we get that number, we're able to then look up the number and research who it actually belongs to or who it came from. From that information, we can track down the owner of the animal. Here at Kane County, we actually take all that microchip information and load it directly to 24-hour Pet Watch, so that if the animal's ever lost, they can call them direct and get the information. They don't need to call us. So we do everything we can to help reunite that animal with that pet. It is not GPS like a lot of people believe. It's just a unique microchip underneath the skin of the animal to allow us to have a unique number that's specific to just that animal. Does that help answer it?
Very much so. Thank you.
Mr. Chairman.
Of course.
Oh, Mr. Tepe was next.
Yeah.
Fern Tepe here. I understand you're having a major issue with rabbits, and I hope you're keeping them separated.
With rabbits, I'm sorry?
Yes, with rabbits. Just hope you're keeping them separated.
Sure.
Never mind.
too early.
That's hard to follow.
He's been all night,
Coffee first, Bert.
he's been all night trying to think of that line.
Brett, Ken Shepro, my understanding is that back when the facility was constructed, it was thought that we would need to actually build within 5 or 6 years a second facility. But at the advent of the almost universal use of the microchips is that the vast majority of animals that are retrieved never make it to the shelter. They're scanned and delivered back to their owners. Is that still the case?
That is what we're pushing. Since I've taken over 7 years ago, our return to owner rates have gone up. We've been great with getting universal scanners into our vehicles. The warden can then contact back to the shelter, and we have reunited a lot of animals with their owners in the field. So that is very correct. It would be beneficial to this facility to expand. There's still other areas that we'd like to look into, and there is a project I have put together that I'm going to present to the board eventually. We're just waiting on some other things right now, but it would be nice to do some expansion of this facility because, again, we are very small, especially compared to all the other Collier counties. It limits some of the things we can do here. It'd be nice to hold some of the biter animals in this county. It would be nice to be able to take some more owner surrenders. We're just very limited. Again, we only have about 23 dog cages, and cats are in roll banks, so it's dependent on what comes to our facility. So it would be nice to eventually expand. It is something in our long-term plans we have in the back of our minds, and it is something I would like to eventually discuss. Just at this moment, it's not reasonable. But yes, microchips have been a huge benefit to keeping animals out of the facility. That's why we do so much to promote them. We now actually use a mini microchip because the old ones, or not the old ones, some companies use larger needles. These mini microchips are meant for like kittens and puppies. They've really made owners feel better about how small the needle is, how much easier it is to give to the animal. But that's part of the reason our numbers are so high right now is we're doing everything we can to promote and do what's best for the animals. So I hope that helps.
Thank you. Just a quick follow-up.
Yes.
How many of your animal retrieval traffic, if I could use that word, are from our contracts with the municipalities as opposed to directly for either the unincorporated areas or other activities? It's just a ballpark, I was wondering.
I'd have to say we're still about, and again, off the top of my head, I can get you exact numbers if you need. We're about 60-40. 60 from unincorporated, 40 from city limits. The main thing we really do in the city limits is take their sick and injured animals. The wildlife is a major component. But of dogs and cats, usually they hold on to them for a couple hours and the owner comes forward. So that's why, again, the bulk of our animals really still do come from unincorporated. But those city contracts, we still make sure that we assist in any way we can with those departments.
Thank you.
Of course.
Mr. Kenyon, did you have a question or comment?
This is about, we found a dead red-tailed hawk, and I'm wondering, do the wildlife people want those animals, want to know you found them?
We don't, but we would reach out to Flint Creek Wildlife, or Anderson has now taken over one of our local wildlife facilities, and reach out to them and see if that's something they're interested in.
We're very
sorry?
disappointed because they take care of the squirrels.
Oh yeah, and they're beautiful. Oh, I absolutely love them. I'm sad to see one go. But yes, we don't need them. The only thing we would need is, of course, the bald eagles, so we can get a hold of the state. But as for the red-tailed hawks, they don't keep track of those. But a wildlife facility always may have use for one, so I'd always recommend to reach out.
How about rabbits?
No, but they take care of rabbits too.
Any other questions or comments for animal control? Brett, I like the picture you used. I can't tell if the cat just got microchipped or is about to. It's kind of ambiguous, leaves you guessing. So, all right. Well, thank you very much, Brett.
Thank you. I love questions too. Thank you, everybody. Have a great day.
All right, you too. All right, we'll move on to the executive directors section. Update on COVID-19. Kathy?
So Michael and Uche are going to be presenting the COVID-19 presentation update.
I don't know if that mic is working.
Oh,
I've noticed.
It's green.
Yeah, it's just not working very, you got to pull real close to your face for it to.
Okay, so,
that's better.
all right. So Michael Isaacson, Assistant Director for Community Health, and Uche Anwuta, Director of Health Protection, will be giving us a presentation for COVID-19 updates today.
Great. Good morning, everyone. Well, we're waiting for the presentation to get queued up here. As Kathy said, I'm Michael. So there's a lot of exciting things going on in the world of COVID right now in terms of the world of COVID getting a little bit smaller. So we're excited with the progress that we're making and the reduction in cases that we're seeing. All right, thank you, sir. So starting off with our test positivity here in Kane County. So again, this is out of every 100 tests that we do for COVID, what percentage are coming back positive? This chart shows the Kane-DuPage region. This is something that we show every month. This is really good news that we're seeing a nice steady decrease. The little purple dots indicate days where there were increases. So you can see over the last 31 days, we've only had 4 days of increases. Otherwise, it's been either declining or stable. So here in the region, we're finally under 5%. And here in Kane County specifically, we're hovering right around 5%. Looking at hospitalizations, and again, these things typically go in order. So as we see more tests positive, we see more cases. Eventually, we see more hospitalizations and then deaths. So this chart is also very exciting because you can see in the month of May, we have had either stable or a decrease in the number of people who are in our hospitals due to COVID-19. So we're trending very much in the right direction on this chart. This, in large part, is due to very successful vaccination campaigns that we have underway. So here in Kane County, we have administered an amazing 422,000 doses of vaccine to our residents. So if you recall, back in January, we were talking about 1,000 a week or 2,000 a week. So it's pretty exciting to see these numbers. I mean, this is real math that we're talking about now, moving towards getting our community protected. We have 36% of the entire population protected, but that includes all age groups. So when we look at who's actually eligible for the vaccine, for our seniors, that was the population that we were most concerned with because that's where we saw the most serious illness and death through the pandemic. With that population, about 85% have had at least one dose of vaccine, which is really tremendous uptake. So that's fantastic. Worked with a lot of our partners, Senior Service Association, Age Guide, other community providers to get vaccine to those populations. We're working very closely with VNA Healthcare still to make sure that all of our homebound seniors are getting access to vaccine. So that's very positive. So we hope to see those numbers continue to go up. In the 16 to 64 age group, we're over 50% of our residents have had at least one shot. So again, every day the numbers are going up more and more. And then exciting news that last week the Pfizer vaccine was made available for people 12 and over. We are seeing a lot of spread in younger people. So that is a group that we really want to encourage families to be going out and getting in to get their kids vaccinated. So those numbers are going up. The first day that 12-year-olds were eligible, we had at our Kane County clinics about 600 12 to 15-year-olds who participated. So that's really fantastic news for us. So things are going very well on the vaccine front. Now we're changing our strategies, and in a few minutes, I'll turn over to my colleague Uche to talk about some of the exciting outreach that we're doing. So just want to highlight how we've gotten to these great numbers. Back in March, we opened up the CaneVax Hub in Batavia, which has been fantastic. We've given well over 100,000 shots between our mass vaccination clinics. So being able to bring in additional resources from the state, both in terms of clinical staff, but also the National Guard to help us. In Aurora, we were able to open up a site on April 2nd. We're working very closely with the city there to staff those sites. In Elgin, on April 7th, we were able to open a site. So that's been very effective. On May 7th, we opened our site at the Spring Hill Mall. So we've been able to get people through a partnership with Jewel Osco to be served there. And then this coming Saturday, we have a clinic that's going to be at Maple Park at the Village Hall. Excuse me. We think that's going to be a good model for future clinics that we can do out in the community. And as we've talked about through this whole process since December, we want to go out and get to where the people are. So we have our sites where people can come to us, and now we're switching to more of a mobile focus. Here's a look at our CaneVax website. Again, we want to make it as easy for people to sign up as possible. They can choose any of our 4 locations. They can look at the calendar and see if they have a preference, which vaccine they'd like. So we're offering all 3 vaccines, Pfizer, Moderna, and the Janssen that's created or produced by Johnson & Johnson, which is the one-shot vaccine. So people can look at the schedule, see where they'd like to go. Also, we like to point out that we are taking walk-ins. So it's great if people register, but if somebody's driving by and just wants to stop in, we encourage them to come in and see us. If somebody is a minor, they do require a signed consent to come in. But we're just excited to continue to be putting up great numbers here. And we do have, when we look at the statewide numbers, Kane County is right around 4th or 5th in terms of counties who have administered at least 1 dose to our residents. So we're one of the higher performing counties in the state. We do have a series of videos that we have produced to try to reach different audiences. There's different reasons why people are hesitant to get vaccine. This, I think, is a really well done. It's about 90 seconds long with Dr. John Devine, who's the medical director with the Rush Copley Medical Group. He's also currently the chair for the Kane County Medical Society. So if we can play this video, I think this is going to resonate with a lot of people.
Everyone who's eligible should get the COVID-19 vaccine. The vaccine is highly effective, very safe. It'll protect you, it'll protect your family, it'll protect your friends, it'll protect the grocery store clerk you come in contact with, the restaurant server, some of whom may have underlying medical conditions you're not aware of. This vaccine has been under development for 10 years in different formats. It's a new technology, but it's been used for other coronaviruses for a while. Most negative effects of the vaccine show up within the first 2 months. We've been given this vaccine for many months globally and a lot in the United States. And we've seen great efficacy and very low risk. Personally, I've had to do a lot of work in our COVID units and even intensive care when our usual hospitalists and intensivists have been overwhelmed. 4 of my long-term patients died from COVID, and a number more have been hospitalized, some of whom have long-term effects still. I myself had COVID, a mild case fortunately, but still not back to full exercise capacity. Because we don't know how long natural immunity lasts, I still got the COVID vaccine, both doses. So I would tell people, even if you've had COVID and believe you have immunity from that, you should still be vaccinated.
So we do have over 17 videos on the health department's YouTube channel. We are pushing these out through our social media. So there's, again, different videos for different audiences. I think Dr. Devine's message, he touched on so many important things, including a lot of what we hear all the time. One, even if you've had COVID, you still should get the COVID vaccine. And I have people even close to me who say, well, I had it last year, so I don't need to get the vaccine. No, we still want you to get the vaccine. Another thing he touched on, and I think that the human side of his video is really touching from a clinician on this, is that people can't have long-lasting effects. So I have good friends who've been hospitalized 6 months after they had COVID, and their COVID case wasn't that severe, but I have a good friend who had a pulmonary embolism, somebody who's under 50. So we want to make sure that younger people, especially healthy people, especially, don't dismiss this disease and say, oh, I'll just get it and it won't be any big deal. Or, oh, my kids will get it and it won't be any big deal. We have a vaccine that can prevent it. So we really want to encourage people to prevent it. Can I get help advancing to the next slide, please? There we go. Thank you. So a couple of changes that have happened in the last couple of weeks. We have entered the bridge to phase 5. So this is how the state looks at mostly capacity limits. So you can see on this chart, and there's a link that's available for people. Being on the bridge has increased capacity slightly in different areas. So you can see many examples. We go from 50% capacity to 60% capacity. So this is looking at numbers. One thing from the health department that we really want to emphasize is capacity is different than other protective things. So bringing more people in, we still want to make sure that people, especially unvaccinated people, are still following the right guidelines. One thing I will highlight though in the changes here with the bridge to phase 5, not yet. I'm practicing patience, like you said. There we go. Thank you. Is around meetings and conferences. And again, this is one of those really exciting things. So perhaps people saw Governor Pritzker talking about the Chicago Auto Show being live again with Mayor Lightfoot. So if you can see on the slide for meetings, conferences, and conventions, we go from what we have been working with for capacity restrictions, which is 50 people as a max. Now we're up to 1,000 people or 60% capacity for the building. Again, we want to encourage that people are taking appropriate safety precautions in there, but this is a really positive sign as we start to move back to normal. The other one I'll draw people's attention to that I think a lot of people are interested in, not only from a business perspective, but also from a social perspective, is this new category they've added, which is called social events. Again, we've been limited to 50 people for this for indoor events. That's going to increase to 250 people. Again, emphasizing a third time, we still want people to take the appropriate protective steps. But for weddings and family reunions and these kind of things, we can start to see people coming back together, which is really exciting. And then finally, last week, the new guidance came out from the Centers for Disease Control around masks. And this is something I think that caught a lot of people by surprise, just how quickly the change seemed to occur. So a couple of highlights from our perspective. One, for unvaccinated people, we still need people to take preventive measures. We need people to social distance. We need people to wear face coverings. The governor just updated his executive order and put that language in there that this relaxation of the masking is not that everybody should just have a big mask burning party, but still that we're moving in the right direction. But if people are not vaccinated, we still want them to be protecting themselves. For fully vaccinated people, it does indicate that we can start to not wear our masks and not social distance. And I bolded there, except where local business and workplace guidance says otherwise. And I just put this on there more as a plea to the public. If you walk into a business and they ask you to wear a mask, that's their right. And we don't know what the health conditions are for people around us. So this is something, and we work with the local chambers of commerce. I met with the Elgin Chamber of Commerce this morning prior to this meeting. All of our business community is trying to figure this out in terms of their internal policies. So this is not flipping a switch and everybody throws away their masks. This is something that we're going to have to work through. And each business is going to have its own rules in terms of how they want to do this. So we just ask everyone to respect those rules when they go into a business, a park district, et cetera. A couple of other things it does loosen on travel, but then I'll just point out the bottom bullet point, which I think is another excellent reason to get vaccinated, is if you are fully vaccinated, then you do not need to quarantine if you're exposed to somebody who has had COVID. So quarantine has been a major disruption to all of us over the past year, whether we're talking about schools or workplaces. So that alone, if saving people's lives isn't enough, that alone is another reason for people to get vaccinated. So to tell more about some of the great work that we have going on, Uche has been leading a lot of our efforts to bring clinics into the community. So I'm going to hand the baton over to Uche Anwuda, our Director of Health Protection.
Good morning. Can you hear me?
The green light on.
Yeah, it's on.
Some of them don't work better than others.
Hello?
There you go. Yeah, that's good.
Let there be light.
Let there be light, she said.
That was why she
Oh,
turned it on.
Vern, was that directed at me? Did I put you to
Woke me
sleep?
up. She woke me up.
Okay, good morning. My name is Uche Onwuta, and I'm the Director of Health Protection at King County Health Department. So my task this morning is to present to you the equity-based closed pod vaccination program that we're working with the Illinois Department of Public Health to bring these vaccination clinics to King County. So essentially, this is to assist people who have barriers to accessing our mass vaccination clinics, the underserved racial ethnic minorities, rural populations who live too far away from the mass vax clinics, the migrant community, the immigrant community and migrant workers, seniors, homeless, chronic mentally ill, LGBTQ, parolees, just pretty much think of anybody who, and also, there are people who would rather not go to a mass vaccination clinic where there are people in uniform. So these are all the people that we try to vaccinate, because for us to increase our vaccination rate, we have to go to where the people are and vaccinate them. Okay, so some of the barriers that we hope to eliminate: language barriers, disability, people who are technologically challenged, like Michael talked about, those that we helped using the 211 and our CaneVax phone line, also offering transportation to those who do not have transportation. Starting next week, Uber and Lyft are providing free transportation to vaccination sites for anyone that wants to get vaccinated. So some of the events we've had in King County, we started off reaching out to large factories and businesses with more than 100 employees. And I just gave, Suncast, Smithfield, that was Aurora Packing. We've also reached out to Hispanic populations, African Americans, community colleges, because essential workers tend to use community colleges, and many of their families trust the community college more than they would trust going to a mass vaccination clinic. We've also partnered with the Chambers of Commerce for the smaller factories and manufacturing. We've held clinics in Elgin and Aurora where we sent out the registration link for them to register their employees. So these are some of the vaccination clinics, some of the facilities that we offered vaccination clinics at their location. And also some of the other community vaccination events that we've had. We also have another program through working with the pharmacy to provide vaccination to another list of manufacturing locations that I have not included here. Okay, so right now, so earlier on in March and April, we focused on essential workers. Right now, as Michael said, as of last week, we have children 12 to 15 included in eligibility for vaccine. So schools are almost closing, and we realized that we could use the school districts to promote vaccination to the children. So we've reached out to many of the school districts hosting vaccination events in at least one school for each of the school districts. The two school districts that are not here, Aurora, well, 3, 129 and 131, as well as Batavia. Batavia is right by the MassVax clinic, so they didn't feel like they needed an additional clinic. The two Aurora school districts are working with the VNA to provide vaccination at the schools. So next week, we hope to host a vaccination clinic in schools in all these school districts. So, okay, so these are the, oh, sorry, am I going back?
Mm-hmm.
Okay, so that was my last slide. Any questions?
Madam Chair.
Okay. Couple of things. Because we have a workplace here of about 1,300 employees, perhaps we can put a focus, not necessarily at this meeting, but at a little ad hoc committee, that we can really start defining what our mask policy is going to be going forward. If it is individual, then I know many of our department heads have reached out and have asked for this advice so that we can have a formal policy. I know that we're working with state's attorney, et cetera, but we need to have a defined policy, even if it's, this is what we're doing right now, and if we get to this goal, this is what we're going to do. And then I would also wondering if we could possibly have here, since we have a number of employees here, some of whom may or may not have gotten vaccinated because of time off, workplace challenges to get the vaccine. If we could have a pop-up clinic here to serve, because I know we had that at the Judicial Center and that was very well received. So I'd like to be able to welcome that opportunity here. The other thing that I'd like to talk about is very quickly, Batavia School District. Perhaps, Mr. Brown, you can help us with this. I realize that Batavia is right next door to the Batavia Clinic, but my concern is that if we don't market it appropriately in Batavia, parents and children may go, oh, yeah, it's right next door. I'll get to it. You know, people who live in New York, yeah, I'll get to the Statue of Liberty eventually. You know, it's right there. Yeah, it's cool. But I think we need not to forget them and not to let them say, it's right next door.
Yeah, I could certainly reach out to Lisa, but when you contact the school districts, do you ask, is this so that they could do a vaccination on one of their properties, or is this so that they can put promotion out that they send home with the kids? How do you do that? What's the protocol?
It's both.
Both.
Right.
And is Batavia not willing to even send the promotion out or information out, or?
No, we just have to reach them differently but I realize what Madam Chair is saying. Maybe we can schedule an event at the MassVax site and call it a Batavia School District event. So we can promote that a little different. But it's very critical for the school districts to reach out to their families because this is who they trust. And you know, what we've gone through with quarantine for the past year, I think, and especially with youth sports, I think a lot of the school districts are interested.
And I do want to clarify that the school districts have all been very supportive of us and sharing information. We meet with all the superintendents on a weekly basis. So
yeah,
everybody's been very helpful through this whole process.
Mm-hmm.
Yeah. Louis, I have a quick question.
Go ahead, Ms. Lewis.
Thank you. So in regards to the schools, are we sending or are we providing the schools with literature that goes home? Because I know I've heard, I live on the east side of Aurora, so District 131. I've heard a lot of the parents say, oh, we don't want our kids to get vaccinated because we don't think there enough testing has been done. And I think the message isn't getting to them that testing has been going on these vaccines long before COVID actually hit. So I was just wondering what kind of information we're providing the schools that goes home to encourage these parents to get these vaccines.
Yeah, absolutely. We do have materials that are in English and Spanish that the schools are sharing with their families. And then through the Navigator program that we've spoken about before, where we have organizations funded in Kane County by the state of Illinois through a project with the Illinois Public Health Association. We're also getting education out more grassroots, so people in the community sharing information with their neighbors. We also are partnering with FEMA, and they're sending teams out to Kane County, and they have distributed thousands of our flyers and posters in English and Spanish, going door to door to businesses and talking to people in the community. And then to the point you brought up, Ms. Lewis, which I think is a really good one, is the whole notion of some of the myths that people have or the misconceptions that people have. We actually have a new piece coming out where we are directly addressing some of those things. So these, and actually Chair Sanchez and our communications team, we had a good discussion about this, that we can't dismiss people's beliefs about these things, and everybody wants what's best for themselves, for their kids. So we need to try to give people the information. So when we hear people being concerned about things like trackers being included, it's easy to laugh off. But if that's what that person believes, we need to figure out how to get that person information to assure them that, and I don't know if Brett's still on the phone, we don't have trackers. We don't even have trackers in our dogs where we can track where they're going, right? So these things that maybe don't make sense to us or resonate with us, these are serious considerations for many of our families. So we want to give them not only the print material, not only share videos with people who look like them that can share the information, but now we're getting to the point where it's really one-on-one discussions and getting people out into the community and having somebody that they trust, which is getting easier because we have so many people who've been vaccinated, that when your friend or neighbor was vaccinated months ago and they're still fine, that's very reassuring to a lot of people. So we have a multi-pronged approach. We're going to start doing radio ads. We're going to start putting information up in bus stops. So there's a lot more we're going to be doing over the coming weeks.
Okay, wonderful. If you have any of those,
sit up here.
Okay, I'll just ask my question from here, though.
Hold on, Ms. Lewis was
Oh, I'm
finishing
sorry.
her thought.
yeah, I just quick question. Especially like the flyers that are going to the schools, could you share those with us? Because, a lot of us are out in the community, and, it would kind of be nice to have that literature too.
Absolutely. Yeah. And I'm sorry we
Awesome.
haven't done that. And
No.
if any board members want print materials, we can certainly supply you with those for any community meetings you have too.
Awesome. Thank you very much.
Ms. Lewis, they are upstairs. We've got posters and we have flyers. So if any board members who's here or online, if you'd like us to get those to you, we can. We can certainly give you as many as you'd like. And if you're here, I encourage you to go upstairs and pick some up and go to your favorite coffee shop or wherever you may be visiting and put up a poster, put out some flyers, help us do the distribution as best you can.
Yeah, awesome. I like email too, though, because I like to post it on, the sites and actually when somebody says something, I'll be like, give me your email, because we all function with that too. But both ways, we need it all, don't we?
And I encourage, if you're not following our Facebook page, please do, because there's some great content that's shareable that we're putting out almost every day.
Mr. Shepro and then Ms. Bates.
Just quick, Michael, do you have any data that kind of breaks down, how many people don't have it because they think they can't get it versus how many have medical reasons, or how many are just continually resistant?
Yeah, no, that's a great question. And we have done focus groups in the community, so we don't have randomized survey data for Kane County to be able to give hard numbers to that. But when we look across the country, we see several different segments. So some people, certainly it's because it's more of a politicized issue. where they may dismiss COVID or may not trust the vaccine as being something that's essential. I've seen, 10 to 14% of people, but that can vary by geography. Also, there's people who may have mistrust, populations who may have mistrust of government in general. And this can be our Latinx and African-American community, as well as people who view this as more of a politicized issue. That's a smaller number as well. So the simple answer to your question is, and we've actually looked at this, and it was rather costly for us to do some of the surveys, so we opted not to do it. But through our focus groups, I think we have a pretty good idea of what the barriers are.
My experience with some of the fire districts, including the one I live in, is that startling number of the younger firefighters have refused to get it. And I'm wondering if there's any ideas about how to maybe focus in on that group, because it seems as if, besides not being entirely rational, they are people. We had one whole shift not recently go down because they had been exposed to somebody, and then when the opportunity to get vaccinated came along, most of them declined.
Right. And I think finding champions, one thing we've done is we worked with the Veterans Commission, and we have some videos with veterans who hopefully for groups and with the video with the doctor as well, for that specific population, they still tend to listen to their doctor, and they have respect for veterans. Many of them are veterans themselves. So again, trying to get like people that we can communicate with and talk to. But I think hearing you say that maybe a more concerted effort with all the fire departments would be a good idea.
I was going to ask if you've got the personnel to go do a presentation at the fire stations on some of these issues, because a lot of times I understand that they're not really asking questions, they're just trolling on the internet for whatever blog is appealing to them. Thank you.
Yeah, thank you for that. And the fire departments have been a fantastic resource. We've had a lot of paramedics helping us give shots. So there may be resistant people, but there's also a lot of people who've jumped right in. So, but we will do some specific outreach. That's a good idea.
Ms. Bates.
I wanted to ask about nursing homes. I think there's a lot of misinformation going on in our nursing homes. I think doctors are dying from the shots. Do we need more work there in the nursing homes, or was there a good uptake?
We've done a really good job with the nursing homes because they were part of the early program. Mm-hmm. The federal government actually directly provided vaccination to them, and they're still reaching out to them. Yeah, we have really good vaccination rates.
Okay, good.
The nursing home.
I have one more question. When are we going to take down the mask required sign so I can stop bringing this with me as a good citizen?
I think we're working on that.
That's what we just talked about. They're going to be working to put together a policy for us to do that.
You go back to the last Human Services Committee, they brought up the subject of reopening the county, and and we're working with state's attorney to find out what that can look like. And, we have to stay within the law, of course, but.
And remember, each workplace can define that on its own. So we're waiting for definition.
Yes, and part of the issue is OSHA has not updated their, the workplace guidance, the CDC workplace guidance, and then OSHA. So it's kind of an issue. It's safety in the workplace. So we just need to, hopefully CDC was ahead of before updating things, so.
Yeah, I think the workplace guidance is supposed to come out this week. We're hoping from CDC.
Mr. Brown?
Yeah, thank you. I got a question. There's a lot of people, I'm going to call them in-betweeners, because you've got the younger generation that does everything on social media, and then you've got the older generation that may be in the retirement homes. But there are still a lot of people that actually go to the mailbox or read the newspaper. What about a direct mailer to all the residents? And I don't know if you have the technology to know who has been vaccinated and who hasn't. I know it'd be money, but I know we we appropriated money for marketing for the health department and other reasons. So I don't know if that's an opportunity or not, or whether it's a good idea or not. I don't know. I just thought I'd throw it out.
I think that we can put together, TAG can get you a pretty quick estimate. I'm just thinking about 100,000 to put together that direct mail piece, unless we segment it to a specific audience to bring down that population pool. So, but I'd say anywhere about 100,000 for the printing to do Kane County. But I agree, the seven touches, however they're touched, you need about 7 times to persuade somebody to do something.
Just a thought.
$100,000 or 100,000 people?
Dollars.
Could you, is there a way of, I mean, do you have the technology? Do you know who's been vaccinated and who hasn't? So you could just send it to those addresses that haven't? I don't know if that technology is there.
We can target certain communities by zip code where we can see what percentage, but I think we don't currently have a database of everybody's address and the process to cross-reference with the, the private medical database that the state has may be too onerous. But I think targeting certain communities may be something that could bring the price down.
Could you just add on to that, if I may? Can you talk about the zip code analysis that you have just received?
Absolutely. So one thing that we previously did not have was information about all of the residents vaccinated in each zip code. So we have complete data for all of the shots that we have provided. We can access that. We can look at anybody who's come to any of our clinics or that we've gone to. But for any of the other providers, and we're the largest provider of vaccine in the community, but for any of the other providers, because it's in a medical database at the state, we had not been able to access that and run the reports based on zip code. So we just have received this information, and I was just communicating with our epidemiologist this morning. She's just putting the reports together where we're now actually going to be able to look at the denominator. So we can say, okay, about 75,000 people live on the east side of Aurora, 60505, and we can compare that to how many people have had shots. And then that's the critical information we need so we can really see, and we all can also look at gender and race and really do the analysis to see where we're missing people. And I think that's going to be tremendously helpful for us. So we should have that very soon. I mean, we have the data, but we're just going through it now.
Ms. Gilms?
Just had a brain thought there when you were talking about there's that middle group. How about taking a full page ad out in the newspapers as cost effective? I mean, people read the newspaper.
Yeah, we're running radio ads. We just approved some radio ads for, was it 97.1 The Drive and 107.9 La Ley. It's a big Mexican station. So we're doing that. Newspaper ads aren't out of the question. I don't think we've really discussed that.
People who read the newspapers already got vaccinated.
Well,
that may very well be true.
Yeah.
96.
Yeah.
There's a population that we're missing there, so.
Yeah. Mr. Shepro.
We might be near the end of the useful part of this discussion, but to Madam Chair's point, some of this sounds a lot like a political campaign, and your comment about, you got to hit people more than once if you want them. And you hear numbers, 3, 4, 5, 6, 7 times, and that then starts to be a massive undertaking. And so we can see that at least in the most recent election, the voter turnout didn't respond to everything people were sending. So I just wonder if those sort of techniques are going to be effective, because in a way we're sort of using the election analogy. We're already past the polling because most people, or at least the large number of people, have already come forward and gotten vaccinated. So it's really like you're trying to get this group that doesn't really want to do it. It's not just they're waiting to see what your campaign literature is going to say. They've, on some level, made a decision, we aren't interested. So it seems to me that that's a different type of approach. And I don't know, I mean, I think if we wanted to do that, I'd almost suggest you pick one district or one category of people and focus on that to see if actually any of these ideas would work.
And I think, if I may, to respond to that, I believe that that's what we're doing. And my analysis of the 7 had nothing to do with politics at all. It's just gold-faced marketing. That's what the marketing approach is, to sell a product. So we're selling good health. So the approaches that they're taking with the campaign are multifaceted. Some perhaps radio ads, which we just mentioned. There's going to be the Facebook ads as well, which is very responsive to people who are engaged in social media. Facebook, of course, has an older population. I think there's going to be another platform as well that they're looking at, that they're going to be marketing as well. We're reaching out to the people who like the river, listen to the river in the Aurora area, Naperville area, et cetera. At Batavia, I think it's the river. It's all mostly through Kane County. And as we go further east to some of our suburbs, they're also now doing a door-to-door campaign, as was previously mentioned. There are pastors who are speaking out on this. There are neighbors who are speaking out on this. So it goes from the intimate, personal, to the academic schools, to the mass marketing. So we are trying as best we can to contact people on all fronts as best as we can. But to your point, the hardest persuasion to do is to have somebody who's reluctant, who has preconceived notions based on emotions and or fear. It could be political on this, which is unfortunate because it simply is about good health, and try to have one-on-one convincing. I will go for any good husband, wife, or child who convinces their family member, let's go get the vaccine, because we're going to go to a wedding and I want you to be able to take your mask off. So that to me is probably the most effective method of campaign, but people have to learn about it. So that to me is what the approach is. Is it political? Unfortunately, it has been politicized, but that's not the intent of any of this at all. It's all about good health.
Suggesting it was
Oh, no, I
political.
understand that.
I was suggesting that the techniques for reaching people
Similar. It's similar.
are similar.
Exactly. You're exactly right.
Do you have any precinct committeemen that'd like to volunteer? Send them our way.
Yeah. We have a goal. I mean, what is our ideal? I mean, 100%, I assume, but realistically, is there a target that you have as to what you want to see?
Yeah, we do not know with the vaccine and with the viruses that are circulating what quote unquote herd immunity is going to be. So initially, when we were giving these presentations in December, January, we would talk about 70%. We'd like to get well over 70%, but we do, to your point, 100% is not realistic. So hitting 70%, I think, is still an initial goal that I have in my mind. That's what I have on the Post-it note on my computer monitor. But that's just an initial goal. We want to get up above that.
I think we're at 36% right now. Is that correct?
Fully
vaccinated. They've assured me that another group of people are coming in to get their second shots, which will increase that number. Our benchmark now is to get to 50. So we're doing smaller chunks. Once we get to 50, we'll put it up to 60. So every time, like exercising, we're going to make it a little bit more challenging, a little bit more robust, and it's going to be harder, just like exercising. You can do 10 push-ups, can you get to 20? And that takes time. So we're going to continue to move that up until we get to the 70.
Michael, you had mentioned, and I don't know where the data came from, about 50% of our population has gotten a first dose. Now, is that skewed because the Janssen shot is only one dose?
So 36% of our population is fully vaccinated. So that means they've either had 2 shots with the Pfizer or Moderna, or they've had the 1 shot of the Johnson & Johnson. The other data that I referenced is who's had at least one shot. And so it could be that they're fully vaccinated, or it could be, as Madam Chair just mentioned, that they had their first shot, but they haven't come in for their second shot. So that for the 16 to 64-year-olds, we're over 50%. And for the 65 and up, we're at 85%. So when you blend those two groups, the numbers, the 36 seems kind of low to me. But we're actually doing much better than that because we have a lot of people who are already queued up to get their second doses.
Okay. Yeah, I was curious because if we know we're 50% first dose and it's only Pfizer and Moderna, then we can safely say that we're pretty close to being 50% fully vaccinated. But because it's the Janssen's in there too, it kind of throws it off.
Right.
So we don't know.
And with this new data, we are able to we'll know how many people have had Johnson & Johnson. So
yeah,
we will be able to do the math on that.
Excellent. Look forward to that. Any other questions or comments for the COVID update section? Instead of giving comments at the end, I figured I'd just throw this in now. You guys mentioned the YouTube videos. We do have a YouTube channel for the health department. You could check it out if you're on social media, maybe share a video once a week, once every 2 weeks, something, just anything to help get it out there. There's a lot to choose from, so you can see which ones might be better for your audience. If you have a political page especially, it's very helpful to share on. Something that I'm seeing, and I know I've discussed this with the team, I was recently contacted by one of the more successful volunteers of the Chicago Vaccine Hunters and Vaccine Angels group. These are volunteers that self-organize to help people, especially senior citizens, but everybody this whole time to get vaccinated, especially when things are very tough. And now they have transitioned to working on the teenage population, but they're still seeing a hesitation, a very large hesitation in the Hispanic, the Latinx community. And the biggest misconception that exists is, unfortunately, the belief that if someone is an undocumented person, they come to get vaccinated, they could get taken away. That somebody else from ICE will be there. Or, if they get a vaccine, the next day someone's going to show up at their house and take them and their family away. This is a real fear. It's founded on a history of distrust of government in immigration policies. But we know for a fact, 100%, put all my money, not that it's a lot, but I'll put all my money on, you will not be deported. You will not be deported if you are vaccinated. And that's an important message. I don't think many people are listening to this.
They can't even ask you, is that correct, for the
Yes.
vaccine?
Yes. The public may not be listening to this much right now, but for board members and anybody who is listening, it's important to send that message out to as many people that may be concerned. We're not even checking IDs. If they don't want to show ID, hey, all right, well, get in there. We still want you to get vaccinated. That's the whole point. There's no coordination going on with any other federal agencies. So it's just, we can't repeat that message enough. As far as the other misconceptions like microchips, I can't really speak to that right now, but I have heard some people get better Wi-Fi after they get a shot. So who knows? Who knows?
And animal control's there to pick them up if they.
Yeah, they're watching. Ms. Strathman.
Is that, Strathman here, is that included in the printed literature that's upstairs that's available for us?
That is not. That's a more targeted message, and it's.
Do we not have Hispanic literature upstairs?
Oh no, we do. We have the flyer that we have is translated, and I believe there's some upstairs that's the translated one as well.
But that's not included in that?
That talking point is not currently, at least.
Okay.
Is that something that would seem to be a prime candidate for a targeted
Yes.
message
And that we're working on.
for that community?
Absolutely. So on our website and in our outreach, that's definitely a point. Whenever we do community presentations, which we're constantly doing community presentations in both English and Spanish, we make ourselves available if anybody would like to connect with us. I know with Mr. Brown, we just spoke with one of his groups recently, but we like to tailor those specific things to each group. We do have pieces that we can print that do have that information on them, though.
Okay.
Mr. Chairman.
Ms. Bates.
So can we get the data for our zip code or our district? So I know if I should get on the phone or.
Oh, that's a good idea.
And we don't have it yet, but it is coming. We have the data and our epidemiologist is working on it right now, trying to compare total population to the people so we can see a percentage vaccinated.
Mhm.
So anytime now, we will have that
Can
information.
you call her and find out where she's at on
I
that?
was just looking, she didn't send it to me yet, but I communicated with her at about 8:30.
It's on YouTube. We're still here, so. All right. Any other questions or comments? Mr. Kenyon?
Not a question, but I know one place that everybody goes, the grocery store. The grocery, if you had if you had information that, I know a lot of my Spanish friends go to Fresh Market and they go to Butera. And if you had a sign up that said, we will have a walk-in clinic, no questions, and let's say next Saturday or something like that. I just wonder if you could get a lot of people like that.
That's me a success.
But if you go down to Butera and Elgin, it's always crowded with people. You know, people got to eat, and not everybody calls up and has that home shopper.
Yeah, we've actually focused on this population working with Illinois Migrant Council, and we've had some really good response, especially up north, Carpentersville. We've had more of our larger clinics with the equity team up in Carpentersville, you know, with the help of Illinois Migrant Council.
Elgin's 50% Spanish.
Yeah, we've also done that in Elgin too with Centro de Información. And I think who they trust is the key. You know, they trust those organizations, you know, and those are the ones that we actually relied on to register people. So they gave them the information we needed, and then we vaccinated them. That was very helpful.
I support your idea, and I think we can handle that very easily. We had talked about putting flyers in the grocery bags, but I don't know. We can do that, and we're going to do it. And so we'll get back to you in the next meeting.
Mr. Chairperson?
Everyone shops at grocery stores.
Dr. Silva?
Thank you. Good morning. So yeah, I'd like to step in both as a member of the Public Health Committee and also a member of the Latinx and Spanish speaking community. I really, I think that what Commissioner Shepro mentioned is extremely insightful. I honestly don't think it's a matter of marketing. The Spanish media, the Spanish speaking media has done an excellent job of providing the same information that we're trying to convey. And in the words of my over 70-year-old, half English, half Spanish speaking mother, she probably knows more about all of the accessibility to vaccines than I do, is what she told me. And I think she's probably correct, because of the media has done a great job of providing this information. So Uche, when you speak about distrust, I think that's really what it is. It's a matter of distrust. I have highly educated friends who both read the newspaper and are members of academia who just won't get the vaccine. So I think that 70% target is a good target, and we can target that within the Latinx community as well, because there are other factors. The community, some members of the older community tend to be conservative. There are concerns with, especially with the pro-life community, about aborted fetus cells or aborted fetuses being used. There are a lot of misconceptions out there. And so the beliefs are deep rooted, and it's not a matter of just, oh, you know, I don't know the vaccines are out there. I think pretty much everybody knows the vaccines are out there. They're just making a decision not to take it for whatever the personal decision is. So I think accessibility is big. I think bringing in influencers, pastors, priests. I know that recently in the church service that I attended, the priest did say, you know, he encouraged the community to get the vaccine, and I think a lot of people from that community did it because of that. But definitely accessibility and just an understanding as a public health committee that these are deep-rooted beliefs, and just compassion, because we all think differently, and we can continue to do our work and target a reasonable number. But definitely, it is a matter of addressing these more fundamental beliefs than it is, I feel, about marketing, at least in the community in my district that I'm close to. Thank you.
Thank you, Dr. Silva.
Good point.
Okay, I think we've had quite a bit of discussion on this. If there's anything else that anybody wants to ask of our public health department, you can send those questions in after the meeting. But I think it's time we should move on to our presentation on mental health.
And
That Michael?
Sure. Would you like me to defer just based on time to next month?
Yeah, we
or-
can defer it to next month. It is
Okay.
Mental Health Awareness Month.
Yeah, I mean, it's here. I can
Kind of-
do it.
it's
I'll
kind
go
of timely.
quickly. Sure.
I'll look at the chairman of the next committee, if that's okay. Yeah?
Okay,
Okay.
very good. We'll get that presentation queued up. So as Mr. Sanchez said, it is Mental Health Awareness Month, and I'm going to share some initial information that we have pulled from our community health assessment, which you're going to learn more about in the coming months. But just to give you a sneak peek, so our community health assessment's just been completed for 2021. We surveyed about 1,500 Kane County residents, just random surveys, and we asked them one question we asked them is, what's the most important community health issue? Mental health was the top issue that was identified. Nutrition, physical activity, and weight was number 2. And I mentioned that because, all of these issues that we talk about are intricately woven together. So being physically active is fantastic for mental health. And when people suffer from poor mental health, frequently their physical health, including their diet and their exercise regime, suffer. Access to healthcare, including behavioral healthcare, is number 3, and alcohol and substance use disorders was number 4. So again, this is when we asked our residents, what's the most important thing? These are the things that they told us. We also asked, what are the quality of life issues that are most important to them in Kane County? Number 1 is the economy. And I think especially as we look at the impact of COVID, the ability to feed a family, the ability to go to work, to pay bills, to not get evicted, all of these things have a huge impact on mental health, not only for the adults, but certainly for the children. Support for families with children came in number 2. Again, with COVID, with distance learning, with challenges with people having to miss work due to quarantine or isolation from illness, being able to provide more supports to our families is critical. Homelessness and housing came in number 3. Crime and neighborhood safety was number 4. And then healthy food options was number 5. So again, this is us asking a randomized set of Kane County residents what's most important to them. We also do something, oh, yes, sir.
Were the survey, were they given a list of categories, or were they invited to spontaneously come up with an answer?
Let me check on that for you, Mr. Shepro, because I don't remember for that. If on this survey, I think they had a list for this particular one, but I'll double check. I'm not sure. I don't want to. You remember? No, this was the assessment. Let me check, and I'll send an email follow-up for you for that. We also did something that's called the Forces of Change assessment, where we bring stakeholders together and we talk about different things going on in the community that may have an impact on health in the future. Things that came up, COVID-19 certainly has had a huge impact, as I've mentioned. K through 12 education, especially when we look at disparities. So we have technology gaps for families who are struggling. We have parents who aren't comfortable with technology. Now they're being asked to help their kids learn via technology. So it's been a very hard year for families and for our schools. Access to healthcare was already mentioned, including behavioral health. Poverty and disparities, so seeing people who don't have access, seeing people who, and I think, again, this is where it all ties together with housing, with access to good jobs, et cetera. And then finally, social unrest. So these surveys were done over the last 6 to 8 months. So the protests and things that we saw last summer were front of people's minds. in terms of what are we going to see come from that. So we saw the social unrest. Now, what's going to be the long-term impact on racism? What's going to be the long-term impact on policing, et cetera? We did also do focus groups with specific populations. So we did African American focus group, we did Spanish language focus groups, we did senior focus groups. A few things that they highlighted that were specific to mental health. One, that there's a tremendous amount of anxiety and stress, right? Every one of us is dealing with this pandemic. And for people who already had underlying issues that they were struggling with, this is just exacerbated over the past year. Social isolation, and this is why we're so thrilled to get so many of our seniors vaccinated. We've had people who couldn't see their grandkids for almost a year. So this social isolation for all age groups has been really tough, especially for our older groups and for our younger population as well. Separation from routine and social networks is having a negative impact. And finally, people talked about being able to access mental health services. So as we've had different rules with in-person learning, we've done more telehealth type things. It's just one more step. In some ways, we found it's easier to access things, and in other ways, it's made it harder. So we'll have to see as we come out of this pandemic where things go. And then cost, availability of appointments, how to navigate the system. These are all items that we've been working on, but that still came up in the focus groups. And then I wanted to keep it brief because I knew we had a long COVID presentation today. So I just want to plant a seed again for future, and we can work with Madam Chair and with Mr. Sanchez in terms of if there's things that you want to hear more about. But for our team around mental health here at the Health Department, we have an early childhood mental health consultation program. So Dr. Susan Mrazek is on our team, and she works with child care centers on them putting practices in place that are supportive of kids. So frequently what may happen is a kid may be acting up and somebody may call and say, I don't know how to deal with this child. Well, the child is a child. The child may be experiencing trauma. They may have drug use or abuse in their home. They may not have eaten. They may have had somebody get arrested in the middle of the night. We don't know why this 4 or 5 year old is acting up. So what Dr. Mrazek does is she goes in and works with the team to say, okay, it's not about the child. It's about how we all respond and what skills can she teach the people who work in that center so that they can better address these things for all. And this specific program is for children, but the truth is it's the same for all of us. Trauma is something, and especially over this past year, there's been a lot of loss and with loved ones and with jobs and things like that, with people being displaced. So we're also going to be talking more about trauma moving forward for how we can all better be supportive, not only in the workplace, but in schools, et cetera. We have an early childhood network. We call it our AOK, All Our Kids Network. Through this group, we do a lot to support our families, including information for COVID. We've been providing a lot of information about where people can access resources. Kim Peterson does a fantastic job now coordinating this project. And we also have a children's mental health initiative, which we've talked about quite a bit in the past, where this is a grant that we have that's a 7-year grant for over $2 million to change the system of care for children's mental health. There's a lot of really exciting things that I'd like to get into a lot more detail with the board about in the future for that. And then we have our opioid initiatives, and we have seen more people coming back and using drugs because of the stressors that are going on. So we're doing a lot of exciting things here. We've just launched a Leave Behind program with the Elgin Police Department, where if there's an overdose, the police department is actually working to leave naloxone there so that potentially we can save a person's life, because we already know somebody has a substance use disorder there at that location. There's great data on this. And I think with the state's attorney, with the sheriff's office, we have a lot of fantastic work going on in all of these areas. So we're all working together. So again, just wanted to give a small introduction and acknowledge. So we have Anna Cerniak and Kate McCormick. We're both licensed clinical social workers on our children's mental health side. And then Sophia Ottamanelli manages our naloxone program. So perhaps we can even bring them in to talk in more detail about these things in the future. But I'll try and keep it short for today.
Anyone have any questions on this issue or anything that they would like to see for next month?
So, Lewis here?
Go ahead, Ms. Lewis.
Okay, I just have a quick question, and I totally understand about the interventions in early childhood and in our children in our schools. But what particular programs do we have for young adults and even older adults in regards to mental health?
Yeah, very good. So for our children's mental health initiative, and that's just the name of the funding, so it's a bit of a misnomer. We do look at kind of the evolving youth, so up to 22, 23, 24-year-olds. So we have just put into place a new electronic referral system where we've had over 100 referrals here in the first month, which is good as we build that up. It's called IRIS, and that's a way that we're able to connect people from organization to organization to get them into a place where their insurance is accepted, the language that they need is there, it's accessible to them, and we're actually able to follow up and see if people make their appointments and actually collect data on that, because that was an informal, decentralized system before. So this is something that just launched last month. That's tremendously helpful for young adults. We're also working very closely with the Juvenile Justice Council through the state's attorney's office on a lot of things around restorative practices. So when people have issues, there's some very proven techniques that we can introduce to help people to get better access. So I think there's quite a bit that we have in place. Right now, we're piloting a survey with primary care providers and behavioral health providers to look at integrated healthcare, so to see how we can better coordinate those two things so that when people go to their doctor, they're getting the appropriate information and the appropriate referrals, and also that our behavioral health people are taking into mind the physical health of people. So.
Okay, any other questions or comments?
Mr. Chairman?
Ms. Bates.
So I'm interested in something that's mysterious to me, a 708 board. We do not have one, is that correct? Do we need one? I believe Aurora Township has one. I've been meaning to call Bill Ketching about that. Is this something we need?
I mean,
We put a referendum on the ballot.
Yeah, the Southern Townships do have a 708 board, and then the City of St. Charles has a 708 board. And so it gets to be a policy question, so I'll step back from that. Do we need more resources for mental health in our community? Absolutely, yes.
Yeah, and I would say, Ms. Bates, that we do need a 708 board for the county, because some people say it's a duplication of services, but it's not. It's an addition of services. The public health department can only do so much.
I should have started with what is it?
We'll talk about that maybe next month.
That's another meeting. All right.
If I may, I believe the previous board, was it 2 years ago, had convened an ad hoc committee to talk about 708 boards, which is a countywide tax or a municipal tax or a township tax to support mental health initiatives. It can be for people with developmental disabilities, as well as those people who may need supports for mental health funding. It is a grant program, oftentimes competitive, where not-for-profit agencies will submit their application to that particular entity, and then a volunteer board that is selected by either the municipality or the township, or an aggregate of, will make those selections and define how much money they have and how much money they can distribute to those organizations. It's done on an annual basis, like the riverboat funding. No, we can use that example. But thank you so much for bringing that up. And perhaps Mr. Sanchez can speak with the health department to see if we can start reconvening that ad hoc committee that was formed previously. We may want to reach out to obviously new members because it's a new community, but I know that people have reached out to me asking if we could start having that done, even though there may be potential lawsuit to the county, the northern part of Kane County, that would be the Dundee and Elgin townships. I don't know where that's at right now, what's going to take place, but they have encouraged the county start reconsidering that. So thank you so much for reminding me about that.
Okay.
Thank you, Madam Chair. Mr. Tepe.
Ms. Bates and any other board member or person that's interested, I've been very involved with the creation of some 708 mental health boards and the aftermath of it, and I'd be happy to answer your questions offline.
Thank you.
Okay, let's move on. We have a resolution. If I could get a motion and a second to discuss and potentially pass authorizing temporary assignment pay for the interim executive director of public health.
So moved.
So moved, Ms.
Strathman.
Strathman. We have a second.
Second, Lewis.
Second by Ms. Lewis. So we recently had a discussion, a lengthy discussion at multiple meetings with the county board on temporary assignment pay increases for the health department. And in our naivete, we had included also the executive director's pay increase. One has to be approved by the board, one does not. And the one that has to be approved by the board is in front of us here today. So that is why we are discussing it here. Does anyone have any questions or comments? Or Ms. Foster, do you have anything you want to add to this conversation at this point?
No, but I'll answer any questions.
Okay. Madam Chair.
I just have some research I'd like to share, and obviously it's the committee's decision to move this forward. I asked if I could see, well, in front of you, what I handed to you is Ms. Foster's pay, all of her salary, ranging from the very first date was on 12/1 of 2020. I'm sorry, 5/31, May of 2020 to the effective date of December 27th, 2020. So you get a chance to see, 12/1, I'm sorry, I'm looking at the dates here, I went backwards. December 1st, 2019 to 1 year later, 2020. So you can see how her salary has changed during that period of time. But also I wanted to take a look so you would have an idea of what the salary ranges are for everybody who's in a director capacity. Certainly not just our department heads, but director range. So those individuals who would have authority, other employees, county employees. And they range from a low of 61,000 to a high of 181,000. So that's a variety of different departments that the board has authority over. This came from 71 different director salaries, and with the mid-range being approximately 105,000. So that's the low of 61,000 to the current high of 181,000. Different departments, different knowledge bases, different responsibilities. But so this committee has an idea of what that is. And there are 8 directors who are making over 130,000.
Before entertaining any other questions or comments, I should say, I don't like to give my opinion as chairman often. I do think this is something that's relevant for more of the board to discuss, but it is completely at the will of the committee of what you want to do. If you want to pass this forward with some discussion on it, either for or against, I do think it would be more appropriate for finance and executive and the board to take a look at it, but that's just me speaking. Mr. Tepe, you had a question?
Do I have a comment? Okay.
Comment.
First off, I object to this type of pay just in general, and I object to this particular one very specifically. We had a very long discussion regarding this interim pay situation, and the way it was solved was by removing this individual's request or this individual's pay from that. Now, immediately, it's back again. We have some tremendous issues to deal with in this county. We have pay situations that are extremely low in certain areas. We have court reporters who are getting like $14 an hour and are leaving us in droves. And for us to take funds like this and handle it in this way is just, in my opinion, wrong. Thank you.
Thank you, Mr. Tepe. Mr. Shepro?
I said a question. Is the reason for the increase and then the decrease simply related to the end of the fiscal year?
I don't have the answer to that
It
question.
was because of the CARES Act ended.
So the 156 included CARES Act, and then when that went away, it went back to the previous amount.
Correct.
Thank you.
Any other questions or comments? Hearing and seeing none.
Question for the
Oh,
chair.
Sure.
Would following up your comment, what would you suggest would be the appropriate action to take at this time?
It's really up to the committee.
I mean, is the idea that to just forward it to finance without a recommendation, or?
You know, again, it's the will of the committee, so.
You are a leader.
Whatever. I am. I do think it's, again, this is coming before the committee because it needed to be separated from the other resolution or the other temporary pay assignment that was for the rest of the health department. This for department heads has to be approved by the full county board.
And to some of the comments that Mr. Tepe made and on previous occasions, this has received a amazing amount of time so far, mostly involved in ultimately wheel spinning, as we said, well, this really shouldn't have been discussed in the first place, and then we separated it out. I guess I would defer to the other committee members who have spoken on this previously as to whether we turn it down, whether we forward it with a favorable or unfavorable recommendation. But I don't know how much more discussion we want to have at it, but probably it should take place at the board level.
My personal opinion, again, would be to forward it with any kind of recommendation from this committee.
Without any?
With
a recommendation.
From this committee.
Mr. Chair.
Mr. Sheppy.
If it is defeated here, why would it go to another committee?
It wouldn't.
Okay.
If it's voted down here, it would.
Thank you.
Stop.
Thank you.
Yep.
That's.
So sorry.
Oh, Lewis here.
Ms. Lewis?
So as I read this, we're just authorizing her a 15% raise because she is taking on so much more responsibility as the interim director. And that then when we would hire a full-time director, and whether that be her or when she goes back to her other job, that 15% would go away. Is that correct?
I'm not actually sure if that, my understanding is it applies to the position. So she is the interim, but you know, whoever is in that position Cannell would probably know more, the specifics. To that.
But it is temporary.
Yeah, well, it is temporary, of course. Yes, this isn't a permanent pay increase.
Right, and this is just for her because she's doing extra duties.
Yeah, well, again, this is we're reinstating kind of the temporary pay increase that happened last year using the CARES Act money. And then recently we had the conversation about the rest of the public health department getting that pay increase again, using health department budgeted money. So this is coming from that.
Mr. Chairman, point of information, the draft resolution has a time frame retroactive to March 21st and ending November 27th, which I gather is the last day of the pay period of the fiscal year.
Correct.
So any further action would have to be the result of a budget adjustment or the budget presumably for the 2022 fiscal year would be my understanding.
Correct. Okay. So is that the will of the committee? Would you like to just vote it up or down right now, or would you like to pass it on with a recommendation?
Let's vote it up or down. Deputy.
Silva,
Go ahead, Ms. Silva.
Hi. Yeah. So I believe that I believe we should send this with a vote up or down. Sending it without a recommendation sends a message, and I feel that we have to make these hard decisions. So I do agree. I think we should vote on it now And if it moves forward, we should send it with a recommendation.
And who are our first and seconds again, clerk?
Strathman and Lewis.
Ms. Strathman, Ms. Lewis, you both first and you motioned and seconded. Would you like to amend that to be a recommendation or just to vote it up, keep it as it is to vote up or down?
I think it makes sense to amend it that depending on our up or down vote, whether or not it moves forward to another committee.
Ms. Lewis, do you agree with that?
Yeah, that's fine. But let's definitely take a vote up or down.
Well, if vote up or down, that's it. If it stops here, it doesn't go anywhere else. So,
Well, then that, okay, I'm sorry, that's what I believe. We should vote up or down. And then if we vote it up, it moves on to finance. If we vote it down, it dies.
okay.
Just a little history. The only time I recall something going forward with a negative recommendation is that when there was a dispute with the circuit clerk, I believe that the appropriate committee voted against, or actually voted to forward it to the full board, but with a negative recommendation. So it can be done that way if you wanted to, but that gets people really confused.
I think we have a motion to vote it up or down.
Yeah.
That seems to be the simplest path at this time. So unless, Mr. Brown?
Yeah, I'm not on the committee, but I've got a couple comments that I guess I'll make, not questions, but comments. If I were on the committee, and I'm not on the executive committee either, but if I was there, I'd have some questions. Some of these questions might be, where are we at with the appointment of a executive director? So we don't have an interim any longer. What is the executive director's salary gonna be, or what was it? And to Mr. Teppe's point, I think, and I know the board has had some discussions about salaries throughout the county in general, whether it be a clerk or whether it be a appointed employee or whether it be an elected official. And I think this is all part of that bigger picture. So if I was on this committee, I'm not sure which way I'd vote on this going up or down at this point, because I'd have a lot of questions.
Well, even if you're opposed to it and you want more conversation, you can still vote yes, and it will go on to further committees.
So Lewis,
Ms. Lewis?
so the way I'm looking at this, and I will vote yes, is the fact that Kathy came in at a very, very difficult time. And she has done an excellent job. She has done everything that we have asked her to do. And to award her this 15% increase from March 21st through November 22nd, I think November 27th, excuse me, is a very reasonable request.
Okay, any other questions or comments?
Call the question.
Clerk, please call the roll.
Lewis,
Lewis, yes.
Shepro,
Pass.
Strathman,
Strathman, yes.
Tepe,
No.
Silva,
Silva, yes.
Sanchez.
Yes.
Call me again.
Okay.
Yes.
Resolution passes and will be forwarded to finance. Okay, under old business, I have nothing. If anyone else has anything, please say it now. I'm going fast. Executive session, we don't have any need. Or reports placed on file. I believe we can just call for a consensus on that. Is that
I was
correct,
good.
Mr.
Yes, I
Shepard?
was about to say I would ask you now, or you can ask unanimous consent.
We have
to
unanimous
place reports
consent.
on file.
Place reports on file. No nays. Thank you very much. No need for executive session. I have no new business. If you do, I'm sorry. Public comments are done.
Motion to
Motion and a second to
adjourn.
adjourn. Mr. Shepro, motions?
Strathman, second.
Seconds, all in favor? Say aye.
Aye. Well done.